name's Cliff Eaton. I'm a clinical specialist with DGO Chattanooga, and today I want to talk to you about this really exciting product called the Chattanooga Wireless Pro. This is a muscle stim device, and the beauty of incorporating muscle stim with your exercise prescription, and I mean that when I say incorporate, I mean combine with. As a therapist, muscle stim should never replace your exercise prescription. There'll be the odd occasion where immediately post-op when the patient can't exercise. And that's when a lot of you use muscle stim to encourage muscle activation. But go beyond this. Combine muscle stim with your exercise prescription and it will make your exercise prescription far more effective. How? Because with muscle stim, we're using an impulse which 98% mimics that sent from the brain. So your muscles don't know or indeed care whether the impulse is coming from a machine or the brain, it's just going to react to it. But the beauty of muscle stim is that I can recruit more motor units and more muscle fibers than I can actively recruit myself. Most of your patients will only be able to recruit about 40% of their muscle fibers. For those of you working with elite athletes, that will be nearer 60%. But even with your elite athlete, we've got this untapped potential. Okay? And later on, we'll see a demonstration about how much more muscle fibers we can recruit. But not only that, we can recruit those muscles and get a training effect in a much shorter space of time. So where it will take you an hour of resistance exercise, let's say, in a gym to build a muscle, you can get that same training effect in about 5 minutes by incorporating muscle stim. Now that's beneficial when most of us in our clinics have a half-hour appointment. And we've got lots of other things that we want to do with our patient, as well as offering exercise prescription. Now, one of the biggest reasons that I choose to incorporate muscle stim, apart from the fact that I can recruit more muscle fibers and get strength gains back quicker, is that I can do that with low constraints on the joints. So if I have an arthritic joint, if I have an arthritic knee, and I ask a patient to exercise, because I know from the literature that's the best thing for that knee, I wonder how much compliance I get to home exercise. Because if that's painful, they're not necessarily going to do it, or they're going to use altered movement patterns to try and find a way of doing your exercise without getting their pain. Now, the joy of using muscle stim is we can recruit those motor units without putting those constraints on our joints. And it's the same thing for things like ACL reconstructions. We know that 50% of our patients have concomitant damage within the knee. That could be the cartilage involvement, meniscal involvement, or chondral deficits. Now, we're still encouraged as therapists to do closed chain exercises because it puts less strain on the graft. So it makes it very challenging for us. But with muscle stim, we can even do open chain exercises very safely by firing up the hamstrings first to promote posterior translation of the tibia, and then getting a co-contraction of our quadriceps. So a very, very sort of useful tool that we can use from beginning to end stage of our rehabilitation. And not only musculoskeletal conditions, but neurological conditions. If I get patients with hypertonia, I can use reciprocal inhibition to reduce the tone in the agonist muscle group. And then obviously use manual techniques to improve range of movement. So your Wireless Pro comes in 4-channel or 2 channel versions. On the 4 channel version, it has 2 of the modular handpieces. Now what this allows us to do is that we can then what that allows us to do is that we can then synchronize however many pods we want to each particular pod. So I may need 4 channels on this particular one because I'm going to work bilaterally. But equally, I may only want to work unilaterally. So for example, I might want to put channel 1 on vastus medialis and channel 2 on vastus lateralis. Now, that then leaves these 2 pods, which I can synchronize with this machine, and one of my colleagues within the clinic can then be using this on another patient. So in effect, I've got 2 machines for the price of 1. What I'd like to show you now is how we can incorporate muscle stim for pain relief and for muscle strengthening. And I'm going to give a very simple demonstration using my forearm. Now I'm going to place 1 pad roughly over the area of my radial nerve, and I'm going to put my other electrode here. Now, I take my pod and I clip it on both ends. If I don't like straggly wires, actually it does have a very nice feature where I can wind the wires around. I take my unit, and it works very much like iPods. I turn it on and it defaults to my favourite programs, which I can scroll through and select. I'm going to go to the home menu and I'm going to scroll down through vascular programs, through pain relief programs, until I get to rehabilitation programs. I select by pressing the lighted button, and it defaults to a program called Disuse Atrophy. Now, muscle atrophy is a big thing we see in clinic, especially associated with arthritis or long-standing painful conditions. One of the nice things I like about this machine is that if I'm not sure what they mean by these particular programs, I can scroll through and get a full description of when and where to put the electrodes and how much intensity to use. If I scroll on again, it very neatly gives me the time for warm-up, the time of my work and rest phases, and my cool down. It also gives me the frequency that I work at. Now, the beauty of muscle stim is by changing the frequency, that's the number of impulses per second you're putting into the tissue, we can have different physiological effects. Now, your type 2 fibres, they fire much quicker, hence why we call them fast twitch fibres. So at 35 Hertz, when my type 1 fibres are working maximally, actually my type 2 fibres are pretty much doing diddly squat. Okay? They're just switching on and off quickly, which we refer to as a twitch. So I know now that I'm looking at type 1 fibres. If I scroll across again, another nice feature is I'm given a body chart which demonstrates where to place my electrodes. This is all very nice, and there's the forearm where I've got it on at the moment. Okay, and I select that. So to start the program, I press the blue button and it says turn on your module. So I come to the module and I have an on-off switch here, and we can see now it's gone green. And what I see in the display is that I've got a little round dot here that shows it's picked it up, and also I've got a full battery. If I was using a second, third or fourth channel, I would do those in the order that I want them to recruit in. And they would light up as well. Now, when I press start, this becomes very interesting. What you see in the screen here is that the pod is scanning my muscle. It's scanning my muscle to identify what is my chronaxy. Chronaxy, wow, big word. Simply means the minimum intensity with a minimum pulse width to get an action potential. Because not only do I want an effective treatment, but I want a safe and comfortable treatment. So I want to deal with minimum energies. Now, chronaxy is a variable. It varies around my body. So the pulse width for my shoulder is different than it is in my calves. As an individual, it's different from me to you, but also can vary during the day. People like to drink coffee. Coffee is a stimulant. It heightens, elevates your central nervous system. Equally, if a patient is dehydrated, that can suppress the central nervous system. So if we take out that, we measure that variable of chronaxy, the intensity level that we see in our screen is a true reflection of the number of motor units and muscle fibers we're recruiting. This number you can put in your medical records, and you'll see as your patient gets stronger that number will go up. And indeed, for sake of comparison, you could do it on the unaffected side to the affected side. Okay, so you can see when you start to get parity. So a very useful tool. When I've pressed start, now it's already scanned me and it's asking me to increase the intensity of the program. And this is flashing here. Now, if I show you what happens on the skin as I press the intensity, this is warm-up phase. So all I'm looking for now is a good muscle twitch. I'm not looking for a tetanic contraction. This is working at 6 Hertz, 6 impulses per second. So my muscle's got enough time to switch on and off before the machine asks it to switch on again. So this is a twitch, and I'm encouraging fresh oxygenated blood into the area to warm the muscle up, if you like. I'm also preparing the peripheral nervous system, ready for it to do some work. Now, the warm-up on here is 2 minutes. So for the sake of video, I'm going to pause here, pause the treatment. As you see, as I pause, I do have the option to fast forward onto work. So I'm going to press the fast forward button, and now I'm ready to do some work. And what we see here is the work phase. On this program, it lasts 6 seconds, followed by 7 seconds of recovery. So when I press start, now it's asking me to increase. Now, what I'm looking for here is the physiological movement of this muscle. If I've got the pad in the right place, I should get wrist extension. So I press the up button. I don't look at the machine. I look at the physiological response of the muscle. So I'm increasing intensity until I get wrist extension. And then it goes off. Okay? So now we're on the rest phase. As I come to the end of the rest phase, I get the muscle contraction and I get taken into wrist extension. Now, a little tip for those of you using muscle stim. When I get to end of range here, the machine doesn't know I'm at end of range. It's still contracting the muscle. Okay? So if I'm using higher intensities, this would be uncomfortable. So a good way to start with your patient is to do an isometric contraction. Say to your patient, don't let it take you up. So now I'm working against it. I'm using my forearm flexors to stop my wrist going into extension. Now, so this means I'm getting a co-contraction between my extensors and my flexors. Now, consider something like ACL rehab. Okay, if you've had a bone tendon bone graft, you want to look after the quadriceps and the hamstrings. You want a co-contraction of your quads and hamstrings. Okay, you can do it very, very neatly by incorporating muscle stim. Okay, so isometric contraction is fine, but of course we want to start getting some functional activity into this muscle. So I know I've got 6 seconds of work with this. So I could take that 6 seconds to do a concentric contraction. And I may well add in some weight here, some resistance band, whatever I'm used to doing, whatever my favorite exercise is. Equally, I could start from here and have 6 seconds to slowly pull down against resistance. And now I'm creating an open chain eccentric exercise, putting load, an optimal load through the muscle and through the tendon. And because of wireless technology, I'm not encumbered by wires. So more end-stage rehab, for example, if I participate in racket sports, I might well have a racket in my hand at this stage. Okay? And as we contract, I can play shots. I can actually work through the kinetic chain. We know how important it is to and the influence that we have on one segment of the body influencing the rest of the body. So how important it is to work through the kinetic chain. So this is fantastic, and we can do this really early stage. So having this wireless technology will allow you, I'll just push it on pause, will allow you to recruit more muscle units and more muscle fibers than patients can actively do themselves. They can train pain-free without putting constraints on their joints. I can, if a patient is getting pain during exercise, I can add in a TENS program. I can actually ablate the pain as I'm doing the exercise. But the beauty of being wireless is that end-stage rehab, I'm not encumbered by wires, I can do agility drills, I can be on a bike, I can be running in the park, whatever. A very, very useful resource, backed by the literature. Professor Tim Watson, University of Hertford, has got over 31,000 pieces of clinical data on this. I won't tell you how many years ago, because I'll age myself, but he told me, as an evidence-based practitioner, every therapist should incorporate muscle stim into their rehabilitation. So I started, guys, and I've never looked back. This is the most useful tool that I've got in my clinic, and I hope to share it with you one day. Thank you very much.